This video of mine is about pancreatitis, which is inflammation in the pancreas. Earlier, I posted a short video about pancreatitis in which I presented an overview about this illness, and I hope you have already seen that video. And today I am going to discuss this illness in detail. Remember, pancreatitis can be acute or chronic, so in this video I will discuss both. Okay, well, the pancreas is a long flat gland that sits tucked behind the stomach in the upper abdomen. The pancreas produces enzymes that help digestion and hormones that help regulate the way your body processes sugar. And these hormones are insulin and glucagon. Well, pancreatitis can occur as acute pancreatitis, meaning it appears suddenly and lasts for days, or pancreatitis can occur as chronic pancreatitis, which is pancreatitis that occurs over many years. Mild cases of pancreatitis may go away without treatment, but severe cases can cause life-threatening complications. Now I will discuss the symptoms. Signs and symptoms of pancreatitis may vary depending on which type you experience. First, I will tell you the signs and symptoms of acute pancreatitis. These include upper abdominal pain that radiates to your back, abdominal pain that feels worse after eating, fever, rapid pulse, nausea, vomiting, tenderness when touching the abdomen. Chronic pancreatitis signs and symptoms include upper abdominal pain, losing weight without trying, oily, smelly stools, that is known as steatorrhea in our medical terminology. Make an appointment with your doctor if you have persistent abdominal pain. Seek immediate medical help if your abdominal pain is so severe that you cannot sit still, or find a position that makes you more comfortable. Now let me tell you the causes. Pancreatitis occurs when digestive enzymes become activated while still in the pancreas, irritating the cells of your pancreas and causing inflammation. With repeated bouts of acute pancreatitis, damage to the pancreas can occur and lead to chronic pancreatitis. Scar tissue may form in the pancreas, causing loss of function. A poorly functioning pancreas can cause digestion problems and diabetes. Conditions that can lead to pancreatitis include abdominal surgery, alcoholism, certain medications, cystic fibrosis, gallstones, high calcium levels in the blood, that is hypercalcemia, which may be caused by an overactive parathyroid gland, that is known as hyperparathyroidism. High triglyceride levels in the blood, that is hypertriglyceridemia, can also be a cause. Infection, injury to the abdomen, obesity, pancreatic cancer are other causes. Okay. Endoscopic retrograde cholangiopancreatography, that is ERCP in short form, which is a procedure used to treat gallstones, also can lead to pancreatitis. And sometimes a cause for pancreatitis is never found. That is what we call an idiopathic. Okay. Now I will tell you the risk factors. Factors that increase your risk of pancreatitis include excessive alcohol consumption. Research shows that heavy alcohol users, people who consume 4 to 5 drinks a day, are at increased risk of pancreatitis. Cigarette smoking. Smokers are on average 3 times more likely to develop chronic pancreatitis compared with non-smokers. The good news is quitting smoking decreases your risk by about half. Obesity. You are more likely to get pancreatitis if you are obese. Family history of pancreatitis. The role of genetics is becoming increasingly recognized in chronic pancreatitis. If you have family members with the condition, your odds increase, especially when combined with other risk factors. Now I will tell you the complications. Pancreatitis can cause serious complications which include pseudocyst. Acute pancreatitis can cause fluid and debris to collect in cyst-like pockets in your pancreas. A large pseudocyst that ruptures can cause complications such as internal bleeding and infection. Acute pancreatitis can make your pancreas vulnerable to bacteria and infection. Pancreatic infections are serious and require intensive treatment such as surgery to remove the infected tissue. Kidney failure. Acute pancreatitis may cause kidney failure, which can be treated with dialysis if the kidney failure is severe and persistent. Breathing problems. Acute pancreatitis can cause chemical changes in your body that affect your lung function, causing the level of oxygen in your blood to fall to dangerously low levels. Diabetes. Damage to insulin producing cells in your pancreas from chronic pancreatitis can lead to diabetes, which is a disease that affects the way your body uses blood sugar. Malnutrition. Both acute and chronic pancreatitis can cause your pancreas to produce fewer of the enzymes that are needed to break down and process nutrients from the food you eat. This can lead to malnutrition, diarrhea, and weight loss, even though you may be eating the same foods or the same amount of food. Pancreatic cancer. Long-standing inflammation in your pancreas caused by chronic pancreatitis is a risk factor for developing pancreatic cancer. Now I will tell you about the diagnosis of pancreatitis. Well, when the patients come to us, we take proper history and we do general physical examinations, and we may order tests and procedure to diagnose pancreatitis. These tests include blood tests to look for elevated levels of pancreatic enzymes, two enzymes which we check, lipase and amylase, which are checked most commonly, and we can see the elevated levels of these enzymes. Okay, we can also order stool tests in chronic pancreatitis to measure levels of fat that could suggest your digestive system is not absorbing nutrients adequately. Computerized tomography CT scan to look for gallstones and assess the extent of pancreas inflammation. We can also advise abdominal ultrasound to look for gallstones and pancreas inflammation. Endoscopic ultrasound to look for inflammation and blockages in the pancreatic duct or bile duct can also be advised. Okay. Magnetic resonance imaging, that is MRI, to look for abnormalities in gallbladder, pancreas, and ducts can also be suggested. Now I will discuss the treatment. Initial treatment in the hospital may include fasting. You will stop eating for a couple of days in the hospital in order to give your pancreas a chance to recover. Once the inflammation in your pancreas is controlled, you may begin drinking clear liquids and eating bland foods. With time, you can go back to your normal diet. If your pancreatitis persists and you still experience pain while eating, your doctor may recommend a feeding tube to help you get nutrition. Pain medications. Pancreatitis can cause severe pain. Your healthcare team will give you medications to help control the pain. Intravenous fluids. As your body devotes energy and fluids to repairing your pancreas, you may become dehydrated. For this reason, you will receive extra fluids through a vein in your arm during your hospital stay. Once your pancreatitis is under control, your health care team can treat the underlying cause of your pancreatitis. Depending on the cause of your pancreatitis, treatments may include procedure to remove bile duct obstructions. Pancreatitis caused by a narrowed or blocked bile duct may require procedures to open or widen the bile duct. A procedure called endoscopic retrograde cholangopancreatography, that is ERCP in short form, uses a long tube with camera on the end to examine your pancreas and bile ducts. The tube is passed down your throat and the camera sends picture of your digestive system to a monitor. ERCP can aid in diagnosing problems in the bile duct and pancreatic duct and in making repairs. In some people, particularly the elderly, ERCP can also lead to acute pancreatitis. So this is a complication of ERCP. Okay. Gallbladder surgery. If gallstones cause your pancreatitis, your doctor may recommend surgery to remove your gallbladder, that is cholecystectomy. And we can also advise pancreas surgery. Surgery may be necessary to drain fluid from your pancreas or to remove diseased tissue. Treatment for alcohol dependence. Drinking several drinks a day for over many years can cause pancreatitis. If this is the cause of your pancreatitis, your doctor may recommend you enter a treatment program for alcohol addiction. Continuing to drink may worsen your pancreatitis and lead to serious complications. Now I will tell you about some additional treatments for chronic pancreatitis. Depending on your situation, chronic pancreatitis may require additional treatment that include pain management. Chronic pancreatitis can cause persistent abdominal pain. Your doctor may recommend medication to control your pain and may refer you to a pain specialist. Severe pain may be relieved with options such as endoscopic ultrasound or surgery to block nerves that sends the pain signal from the pancreas to the brain. Enzymes to improve digestion. In pancreas, enzyme supplements can help your body break down and process the nutrients in the foods you eat. Pancreatic enzymes are taken with each meal. Changes to your diet. Your doctor may refer you to a dietitian who can help you plan low-fat meals that are high in nutrients. Okay. Now I will tell you about some lifestyle and home remedies. Once you leave the hospital, you can take steps to continue your recovery from pancreatitis, such as stop drinking alcohol. If you are unable to stop drinking alcohol on your own, ask your doctor for help. Your doctor can refer you to local programs to help you stop drinking. Stop smoking. If you smoke, quit. If you do not smoke, do not start. If you cannot quit on your own, ask your doctor for help. Medications and counseling can help you quit smoking. Choosing a low-fat diet. Choose a diet that limits fat and emphasizes fresh fruits and vegetables, whole grains, and lean protein. Drink more fluids. Pancreatitis can cause dehydration, so drink more fluids throughout the day. It may help to keep a water bottle or glass of water with you. And now I will discuss some role of alternative medicine. Alternative therapies cannot treat pancreatitis, but some alternative therapies may help you cope with the pain associated with pancreatitis. People with chronic pancreatitis may experience constant pain that is not easily controlled with medication. Usually complementary and alternative medication therapies along with medications prescribed by your doctor may help you feel more in control of your pain. Examples of alternative therapies that may help you cope with pain include meditation, relaxation exercises, yoga, and acupuncture. Well, this was my video about pancreatitis. I hope you have liked this video.